pandemic COVID-19 post-COVID syndrome. This name of pandemic allows us to better understand the meaning of the use of Hirudotherapy treatment. Next slide, please. The diagnosis of post-COVID syndrome was formulated thanks to a collective brainstorming session of the Moscow City Scientific Therapeutic Society, named after Professor Botkin, MCSTS, during a significant number of observation and analysis of patients during 2020 to 2021. In the person of its leader, Professor Vorobyov, this diagnosis is follows. Post-COVID syndrome is a chronically occurring thrombovasculitis with a predominant lesion of the nervous system, brain, autonomic and peripheral system, and skin. The team of authors of the Moscow City Scientific Therapeutic Society proposed the following strategy of the treatment of post-COVID syndrome. First, the use of direct anticoagulants. Second, plasmapheresis, at least 900 milliliter per one procedure, at least 5 procedures, frequency every other day, replacement of plasma with physiological saline to relieve intoxication. Next slide, please. Without denying the importance of proposed therapy, we offer an alternative way to solve the problem of reducing mortality from pneumonia and other complications caused by COVID-19. This alternative treatment is the use of the system method of leaching, SML. The proposed solution is based on almost 30 years of experience in the use of SML in elderly people with multi-organ pathology and children treated in the Academy of Hirudotherapy of St. Petersburg. Our experiments in the treatment of post-COVID syndrome 2020 to 2023 shows that it is possible, moreover, with high efficiency. Based on the analysis of the mechanism of pathogenesis of the COVID-19 virus, our article was published priority on April 21, 2021, in relation to the treatment of post-COVID syndrome. COVID-19 prospects the treatment of rehabilitation of post-COVID syndrome by Ayurvedic method Hirudotherapy after scientific medical sciences. Even earlier, an article was published on reducing mortality from complication of post-COVID syndrome, as well as in complication arising from vaccination against coronavirus, regardless of the type of vaccines used. COVID-19 theoretical and practical substantiation for reduced mortality from complications after scientific and medical sciences. Next slide, please. The author of this message owns a series of publications in the period 2020 to 2023, highlighting the features of pathogenesis of new disease, COVID-19 post-COVID syndrome, as well as a method of treatment and prevention of this disease based on scientifically proven medicinal properties of the medical leech, Hirudo medicinalis. The editors of 6 scientific medical journals adopted the author's concept of the name of the disease, COVID-19 post-COVID syndrome. This definition of a new pandemic is important not only from a taxonomic point of view, but above all from a mental point of view, since it gives the doctor an understanding of complexity of the disease and requires monitoring patients throughout this period. For example, monitoring the dynamics of D-dimers, prothrombin time, platelet count, and the level of fibrinogen in the blood of convalescents. Now, these are the most informative markers of the dangers of thrombosis. Next slide. The term long COVID does not reflect the substance of the disease process. In addition, in the series of publications, we analyzed the most recent and proven various aspects of pathogenesis of COVID-19 post-COVID syndrome. As a result of this campaign, our recommendations are as follows. In the acute period of the disease, we conduct leaching courses daily, and in the second phase of the disease, 2 sessions per week for 18 to 24 months. This technology is a serious alternative to oral anticoagulants and plasmapheresis. The use of direct anticoagulants has a number of significant contraindications and complications in the defeat of the central nervous system, can cause bleeding, nasal, throat, and renal. Plasmapheresis is available only to well-equipped clinics. Next slide. This alternative treatment is the use of the system method of leaching. The proposed solution is based along with 30 years of experience in the use of SML in elderly people with multi-organ pathology in children treated in the Academy of Hирудотерапия